Well, we're back again on Triple R's Radiotherapy. It's Dr. Anna Bollock speaking here, and I've got Dr. SK and Dr. Perry Parton with me in the studio. Now, we have online a lady called Penny Stoyles, and I'm going to check to see whether you're there, Penny. Hello, Penny.
Hello, I'm here, yes. Hello, Anna Bollock.
Hello, how are you, Penny? Look, thank you so much for coming on this morning. You're in the studio with the three of us today, and you've been involved very heavily with a group called the Gynecological Oncology Group. Is that right?
Yes, it's called ANZGOG for short, but it's the Australian
That's good. I'm glad it's called
Australian New Zealand Gynecological Oncology Group, which is hard to say in one breath.
Fantastic. Yeah. And who are they? Who are they, Penny?
Well, they're a group of about 700 members who are doctors and clinicians and nurses and so on. It's a not-for-profit organisation, and they sort of sponsor and devise clinical research into gynecological cancers. So clinical research is the way changes are made in the way different cancers are treated.
Okay, and how are you involved? How did you get to be involved in this group?
Well, I'm actually not a clinician or a doctor or a nurse or anything. I'm a patient. I was a patient. So 30 years ago I had cervix cancer, and I got involved in a local cancer support group here in Melbourne, and it was doing that for quite a long time. And then I was asked to join their consumer and community committee. So there are about 5 of us who have had various different gynecological cancers who provide advice from the consumer's point of view or the patient's point of view.
Okay, and so this has been a long journey for you by the sound of it, 30 years since you had the diagnosis. You sound like you're doing well, which is very pleasing.
Oh, look, well, one of the things is I had cervix cancer, and back in the day the standard treatment was a radical hysterectomy. Yes. So that cured my cancer, but it also meant I lost my fertility, yes. And I hadn't had children at that stage. One of the stories I tell now is that through, little step-by-step changes, women who are now diagnosed with my type of cervix cancer could have surgery that actually preserves their fertility.
How would that happen? They would have a less radical procedure, do you mean?
Yeah, they'd have a less radical procedure where only part of the cervix is removed rather than their whole uterus. Yeah.
Okay.
And so that's one of the things that's happened through clinical trials.
So the funding those clinical trials is often the problem, isn't it?
Yes, yeah. Well, so ANZGOG, the not-for-profit organisation, so it gets most of its money from government grants, philanthropists and through fundraising, which is what this Go Step for Gynae is all about, raising funds as well as having fun and getting fit.
So tell us, what is Go Step for Gynae? I was going to ask you, what is that? Sounds a very catchy name.
Well, it's a challenge to do 10,000 steps a day for 30 days. And you can begin any time in March or April. Right. And you register through Everyday Hero. So there's a web address, everydayhero.com.au/event /go step 2017.
Right.
So people can register there. Then if you do that, you get a fit band and a whole lot of advice and a unique code, so you can then invite your friends or family to sponsor you for your 10,000 steps a day. And so that basically raises some funds for clinical trials. It also spreads the word a bit. So, and it gets you fitter. So there's 3 good things that happen there. We know a lot of cancers and a lot of gynecological cancers are related to obesity, so we're trying to get that message across that if you get fit and eat well, then you're reducing your chance of cancer. We're trying to raise awareness because we know lots of women don't talk about cancer down there.
Yep.
And they should talk about it more. And we also want people to have fun.
So, and in that, I just heard you say that you get a free fit band. Is that one of those things that clocks you?
Yeah, you do.
That sounds like a pretty good deal.
Yeah, you get it. It clocks your steps and your calorie counter and your heart rate. Yeah.
So we raise money while we get fit if we participate.
Yes.
That sounds brilliant. And where's the money going to be going to? Do you know who receives the research funding when it's raised?
Well, Well, what happens is various groups of doctors, so it's sort of cooperative research, put into ANZCOG to say we want to do a clinical trial. It goes through a whole lot of processes, both at the hospital level and at ANZCOG level, to say yes, this trial may go ahead. And then they recruit patients, so ask patients who are in the right demographic if they'd like to go on the trial, and it costs around about $15,000 a year to keep a patient on a trial. So the patients don't have to pay anything.
Right.
So that's the sort of funding it goes to.
Okay.
Yeah.
And have you had much over the last few years? Have you seen any results from any of your fundraising?
Well, we've basically raised quite a lot of money. In terms of specific results, not these trials take quite a long time.
Sure.
But basically, we're sort of the trials are aiming to not find the miracle cure. That's not what we're on about, because most of our cancers are treated by a mixture of chemotherapy, radiotherapy, and surgery. So it's trying to sort of tweak that to find what's best, what gives women the best quality of life.
Yes.
To increase their lifespan, or to reduce harmful side effects of, the current treatments, because we all know that, chemo and radiotherapy aren't the nicest things to have to go through. Yeah.
And Penny, Dr. SK here, just a quick question.
Hello.
Does the work of ANZCOG cover the whole gamut of female reproductive cancers, or is it more
does,
focused on cervical cancer?
No, not at all. It covers over ovarian, cervical cancer, endometrial, or it's sometimes called uterine cancer, so people get a bit mixed up about those two, and some other rarer cancers like fallopian tube and vulva cancer. And I think it's important to know that even though all those bits of a woman's body are pretty close together, the cancers are usually quite different and unrelated. So you can't say, I've got one treatment or one process you go through if you've got a gynecological cancer. They're all quite different. And what I believe is being found lately is with increased obesity in the population, the rate of uterine or endometrial cancer has gone up markedly, which is a real worry.
Okay, we've seen great breakthroughs in the last 10 or so years with cervical cancer, with the cervical cancer vaccine. Is there anything similarly promising on the horizon for other types of cancer?
Well, I don't think so, because cervix cancer is the only one of these cancers that actually there is a test for, and that you can find out that it's happening, in the pre-cancer stage, really just before it gets really bad. But all the other ones, there is no test for. So that's really, it's really important that women know their own body, and if they think anything's going wrong or it's not quite right, that they really get it tested out, I think, or go to their GP or a doctor and just get checked out, not be embarrassed about it.
And hello, Penny. Dr. Perry Pardham here. Hi. Just very interested in all of this stuff, because that's the kind of psychiatry I do with women who are having babies. I wonder if you could just describe some of the symptoms that you think women should mention to their doctor if they are concerned. They're very non-specific, but there is a kind of a group of symptoms, aren't there, that could indicate they had endometrial or other cancers?
Yeah, I think any sort of unusual bloating, sort of in the abdomen, and they're sort of feeling full really quickly, unusually quickly. That's, I think, often related to ovarian cancer, and I'm not a doctor.
Sorry.
Endometrial
not
cancer.
A fair question.
Sort of abdo pain, anything that goes a bit unusual with your bowel or your bladder, like frequent urination or having diarrhea or constipation, that sort of thing when you're not sure. Any sort of irregularity with periods and unusual discharges and things like that.
So the idea is not to ignore those sorts of things, but to get them sorted out.
Unusual pain during intercourse, even that sort of thing. Yeah, and somebody once said to me, "Oh, I don't like talking about it," or it's a bit embarrassing or something. But a very good way of doing it is when you go into the doctor, you hang your dignity up on the door.
Yes.
Book, and then you pick it up on the way out again. I think that's the best way to deal with it.
That's a lesson for women about pap smears and men about rectal cancer and prostate cancer. That's exactly right.
The other one is nobody ever dies of embarrassment.
Yes. That's a really good thing to remember. And really these tests are quite quick. They're quite non-traumatic. There's no puncturing of skin usually involved. It's just a quick wipe or something, and it's all. And it's
for
peace
your
of mind.
pap smears, but I think for ovarian and uterine cancer, it's more about a pelvic exam and a bit of a poke around to see if there's any lumps and bumps, and then working from there.
And it's enormous peace of mind, isn't it, when you do get that checked? It is enormous peace of mind.
I know women who've had cancers, and they still go back, even though the doctor says you don't need a checkup anymore, you're 5 years down the track. They still go and have a checkup every year just for the peace of mind. I think it's really important. And that's what our support group, when it was running more than it is now, we set up our support group before Facebook. So, it was a way of getting together. And now a lot of these groups happen through social media. But, it's just good to talk to people and say, is this normal or is this not normal? Or, have a chat about that. Have a chat about how you're feeling. And we even encourage the male partners to come along, every now and then, and they get together and have a chat as well, because they find it, it's often very difficult to cope with.
Yes. Well, everyone's got a woman in their life.
Cancer. Yeah, it's difficult to cope with the cancer, but it's difficult to cope with when it affects your femininity.
Yes, of course. It's a double whammy, I guess, in that sense, isn't it? Yeah. And are you still working with the group, or you've moved to other things now and working on the fundraising?
I work with ANZCOG to do the fundraising. Our support group is still going, but there's not the need for it as much for the two reasons, the social media reason I just mentioned, but also, luckily, cervix cancer is going down in the population quite a bit for the fact that we're now doing testing, there's a vaccination, but also, there is a bit more awareness and testing happening. And so hopefully once the whole population gets vaccinated and the new HPV tests come in, it'll even reduce the incidence more and more.
So, that's right, isn't it, Penny, that there's a new test for, it's still a pap smear, but they're actually doing a slightly different test on the
I don't know an awful lot about it. I believe it's going to be introduced later this year. But I think it's working in conjunction with the fact that the population's being vaccinated as well.
Yes.
So it's a double sort of procedure for controlling and reducing the amount of cervix cancer in the population, which is fantastic.
Well, this week we saw International Women's Day last week, and one of the suggestions that was made was to think about what would happen with a day without women doing the work they do. And you're an example, Penny, of one of the thousands and thousands of women in the background of our communities who just work tirelessly on things like fundraising, which is overwhelmingly driven by women in our society all over the place, in charities of all kinds. So marvellous that you're doing this, and marvellous you've raised so much money already. So thank you so much for all that, and good luck with your new...
Thank you for giving us a bit of time and being an advocate for ANZCOG as well.
Do you want to put a last wrap in for the website that we're all going to go to now and get our fit bands?
Yes. It's called Everyday Hero, all one word, .com.au/event and then /Go Step 2017.
Well, all our listeners are going to the website as we speak. Thank you so much, Penny.
I hope so.
Good luck with that.
Thank you for the time.
No worries. Have a good morning. Bye.
Thank you. Bye.
So that was...